Hey guys, Nurse Alyssa here. Today we're going to be talking about Coban 2 Lite compression therapy. But before we get started, if you could hit like and subscribe, it would be greatly appreciated. So Coban 2 Lite is a single-use, latex-free, two-layer inelastic short stretch system providing compression of 20 to 30 up to 7 days. So we are going to use the Coban 2 Lite compression for clients with an ABPI between 0.5 and 0.8, requiring moderate compression therapy for treatment of venous insufficiency, mixed arterial and venous insufficiency, lymphedema, and just generalized lower limb edema. And this can be with or without wounds. Okay, so I have added the ABPI chart here. So this is directly from Coban, and it shows here, so you would use the two-layer light compression system in these two areas here. Okay, and then for people with a normal ABPI, so in this area, you can either use the light or the normal Coban 2 layer. It just depends on the strength of compression needed to remove the fluid from the legs. So this is precautions for compressions in general. So an ABPI is always needed before applying compression because you want to make sure that the patient's legs can actually handle being compressed. So this does need to be approved by either a physician, nurse practitioner, or wound care specialist. Very thin legs need to be protected, so the bony prominences, they need to be protected from the pressure. And if you noticed that the patient has pain, has pale, cool, or numb toes, or signs of heart failure, you need to remove the compressions immediately and get a hold of the ordering physician, nurse practitioner, or wound care specialist. Contraindications. So we are not going to use this in the presence of uncontrolled heart failure. And we're also not going to use compression therapy on any legs that have wounds that are infected and have not been treated. So as long as a wound is being treated for the infection, if there is an infection there, you can put them on. But if it is untreated, you haven't got a hold of the doctor yet to treat the infection, it needs to be treated before you ever apply compression. So just like any compression, you want to make sure you're putting it on in the early morning. So first you're going to wash or shower the legs and apply a moisturizer because when something is staying on your leg for such a long period of time, even a few days, skin tends to get quite dry under compressions. So put on a moisturizer, let it absorb and dry before wrapping. If there is any wounds on the legs, you want to wrap it with an appropriate cover dressing to make sure it is managing the exudate for however long you're keeping the compression system on for. So when you go to apply the compression system, you want to make sure that they are in a dorsiflex. So you can see here, the foot is in a dorsiflex, so it's flexed upward, but the calf is in a relaxed state. This allows them to be able to walk properly. If you have the foot down when the person goes walk, it's just going to start rubbing and bunch up. So the first step is the comfort foam layer. So this does not contain any compression and you just want to put it on softly on the skin. You're not stretching it or anything like that. So it does have two sides. There is a white side and a brown side. The white side is kind of foamy when you touch it. That's the side you want to put against the skin. So white to the skin, with very minimal overlap. You don't want gaps in the foam, but you do not want to overlap by much either. This is just a comfort layer. So once again, here you can see they have the patient's foot in a dorsiflex position. So it's a 90-degree with the calf relaxed. So you start at the baby toe and you're going to wrap around the foot. Now here, you're not going to go underneath the heel. You're going to go in on the back of the heel, kind of flat where the foot would be on the ground, but not actually under the heel. And then you're going to wrap upwards and you're going to go all the way up to 2 fingers behind the knee, just 2 fingers, and that's where you're going to stop there, so the patient can bend their knee properly. So you'll cut off any excess and you're just going to put light pressure down on it, and it'll hold there. You can put a little piece of tape if you would like. So next, the second layer is actually our compression layer. So the compression layer, with any Coban, you're going to apply it at full stretch, okay? That's how we're making sure we're getting that 20 to 30 compression on the leg. So you're going to start at the baby toe again, right here. And you're going to wrap it around. You're going to do a few figure eights around the actual ankle part, making sure that the heel is fully enclosed. You don't want any gaps in the heel here. And then you're going to wrap up the leg, and you will then stop 2 fingers below the knee. So right where the comfort layer stops, you stop with the compression layer also. And then you're just going to press it all down so it sticks, because both layers that are touching each other will grip together. And you might want to add a little piece of tape just to make sure at the top that it does stick together. And then for removal, you just cut off the system, or you can unwrap it, but I find it's easiest to cut it off. So as I stated before, you can keep this compression system on for up to 7 days. Now that if there's any slippage or wounds are present, it might be earlier than that. You might have to change it twice a week. That's what I've really noticed in practice, that I have to do this twice a week when wounds are involved, because you want to be checking on them and making sure that the exudate isn't coming through the compression system. You want to make sure the exudate is managed well and it's not saturating any of the peri-wound, because that's going to make the wound larger. So the expected outcome is that we have a measurable improvement within 1 week. So we are measuring the leg once a week, and we're making sure that it is getting smaller. So that's all I have for today's video. I'll catch you next time.